Hello, everybody. It is noon. We're getting ready to do our webinar here on ozone, and we're going to give everybody just a few more minutes because we know that this is lunchtime and work and life gets crazy. For those of you who are here with us, there is a chat box, so feel free to use that. If you have questions or comments or what have you, feel free to let us know. And I'm actually interested if any of you care to volunteer if you've ever had ozone before. So feel free to let us know. So just 2 more minutes then. Make sure you've got some water or your lunch. In fact, speaking of, ooh, we've already got questions already. This is exciting. Okay, so we've had some people use ointment. I've done that too. It's got quite the smell to it. How long have we been providing ozone? Okay, so ozone is new to Desert Wellness Center, but not new to our providers. So most of us have experienced it in one way or another, either at another office or as part of our training, or as a patient, we've been treated ourselves. We're doing the latest on continuing education for this, so we're bringing what is the newest and the coolest here. And ozone itself has been around for a very, very long time, so we're going to be digging into that for a little bit. But as far as here at Desert Wellness Center, it is new. We've got a couple people who've never heard of it before, so this is going to be extra fun for them. And a question on my thoughts on red light therapy. I think it's amazing. There's a lot of new stuff coming out on all of the different light therapies, and they're doing more and more research on it, and it just kind of keeps getting better and better. So I think that over time we'll learn what makes for a quality red light treatment, but I've seen it do some pretty amazing things for people. So if you've got that, or if it's part of your routine, have at it. So, all right, it is now 12:04, so I think we'll go ahead and get rocking and rolling. If you've just joined us, feel free to type into the chat box if you have questions or comments, and we'll go ahead and get going here. So thank you for joining me. Thank you for taking time out of your day. I know this is quite the thing. You could be eating lunch in peace right now or scrolling the internet. So we're going to make this kind of short and sweet and hopefully deeply worth your time. So ozone therapy is very, very cool stuff. We're going to go over all the ins and outs here today. So many different applications. So as you're thinking, you might be thinking of yourself or maybe a family member or a friend. So feel free to pass the word along as well. Ozone itself is O3. So it's a gas that it is basically 3 oxygen molecules all sandwiched together. The oxygen that we breathe is only 2 oxygen molecules sandwiched together. And so you could think of this as ultra pure and ultra concentrated. The air that we breathe also has other things in it. It's got air pollution and nitrogen and lots of other stuff. The ozone that we use, medically speaking, is only O3. And that's really important. We're going to kind of get to why that is here in just a second. So the biggest question we get is, isn't it pollution, right? I think this is what most people think of when they hear the word ozone, is ozone pollution. You hear about it in the news and the traffic reports and, carpool advisories and that kind of thing. It's not actually. So when pollution levels are high in the ambient air, ozone also happens to be high in the ambient air, but it's much cheaper and easier to measure ozone. And so we use it as a proxy. And so the ozone itself is not pollution. We would never give someone pollution as a medical treatment. But that's why those two words very often are linked, right? It's just easier to measure that one piece rather than try to measure all of the other individual pollutants and dust particles and that kind of stuff. So we don't need to worry about that. We can just take that piece right off the table. And we have, let's see, EBOO, ozone therapy, or regular therapy. So I'm actually not entirely sure what the EBOO stands for. We're going to get to the two different ways that we're going to be administering ozone in a little bit. So oxygen. Really, oxygen is our most critical thing. If you think about it, we can go a month or two without food. We wouldn't like it. It would be pretty ugly, but it can be done. We can only survive maybe 3 days without water. So I'm going to take this little minute to say, we live in the desert. Please, everybody, make sure you're drinking your water, especially with this insane heat wave we're having. And we can only survive maybe 4 minutes without oxygen. So that gives you an idea just exactly how critical this element is. If we don't have enough, everything in our body, there is not a single cell that is spared. Everything shuts down and ultimately dies. And so, you can think about when we're talking about really optimizing function, how critical it is to make sure that you have optimal oxygen. Everything kind of hinges on that. Now it's not the only element, right? You can't live on just oxygen. You also have to have things like food and water and community and all of those things. But oxygen, that's our key here. So this little picture, I promise not to make this too sciencey, but we do need to see these things just to kind of understand what we're dealing with here. I don't know if you guys can see my mouse or not, but oxygen, just plain O2, has this nice stable double bond. These little guys aren't doing anything. It takes a lot of work to separate these things. Ozone itself, though, has this little business going on here with these positive and negative charges and this loose bond. And that's where all of the magic comes from. And so when you kind of donate those electrons and you release that oxygen, technically it is an oxidizing therapy. So when you hear about things like oxidation or antioxidants, you think, oh my goodness, is this going to cause damage? Is this ozone going to cause damage? And the short answer is no. So in going through that oxidizing process, it actually activates all of our inborn systems to produce antioxidants. So for those of you who like to geek out on this kind of thing, you've got your glutathione reductase, superoxide dismutase, nitric oxide. All of these things they need oxidation in order to work. And those enzymes are the things that then clear up all of our free radicals and repair that damage. So it's a little bit counterintuitive, but the antioxidants that we're adding in, things like vitamin C, vitamin E, selenium, those only can work if they've also got the enzymes to make it happen. So, here we go. We've got an EBO, extracorporeal blood oxygenation. Yes, that's what we're doing. So it just goes by a different name. So we'll get to that. All right. So the other thing that this does is when that ozone comes in contact with your blood, it creates these short-changed ozonides, which are a very stable molecule. And so they're going to continue to work their magic in the bloodstream for days or even weeks after treatment. So it's not like, some things where you get an infusion and it works and it does its thing for just a couple of hours and then it's done. This is going to have a pretty lasting effect for you. And you don't have to worry about any free radical formation. So that's what we worry about with oxidizing therapies is it going to create these free radicals and create this damage? That can only happen in a pH over 8 because of the type of bond in that molecule. And so nothing in the human body is a pH above 8. So you don't have to worry about that. If we were oxidizing other things that were a base solution, yeah, we'd have a problem. But in this case, perfectly safe. So energy. Now this is, for those of you who maybe remember from high school biology class, the mitochondria of the cell, the engine of the cell, the thing that creates all of your energy. That's this picture of this little pill looking thing on the left. Everything that your body does relies on the mitochondria. This is where we make our energy so that we can do the things that we need to do, whether that's digest a meal, move a muscle, repair a wound, those kinds of things. And within the mitochondria, in all these little nooks and crannies, you have the electron transport chain. Now, this is a very simplistic drawing here, so bear with me if I have any chemistry geeks in the room. But we take, our kind of substrate things, and it goes through this process, and we transport electrons. That's why they call it the electron transport chain. And this all gets mixed up with oxygen. This is really the critical thing. You've got to have that O2 molecule there. And once you add that oxygen to the piece, you create water and you create energy. So ATP is the thing that fires up all the other processes. And so that's sort of a really great lead-in, basically, that we need sufficient, and I would argue that we need, in fact, optimal oxygen levels body-wide in order for everything to function optimally, or even to function at all, really. And so as we age, we end up, the condition has sort of been coined decreased oxygen utilization. Just like everything else, the whole process doesn't work quite as efficiently as we age, right? And so, we don't extract energy from our food as well. Metabolism slows down. I think we've all experienced a little bit of this, unless we've got some young ones in the room. But so, yeah, it's not as efficient. We lose our mitochondrial number. We don't have as many, and the mitochondria that we have perhaps don't function as readily as they used to. The more oxygen that we can drive into this system, the more we kind of reactivate that. We reboot that system so that our mitochondria can function better, and we create more of this ATP, which then allows the cells to do the things they need to do better. So it kind of restores that youthful function and capacity. And so decreased oxygen utilization then is something that has been researched. There has been quite a bit of research done on all of this. I just didn't want to bore you guys with the links. And so when we don't use oxygen well, it directly leads to and has been linked with aging. And so they've actually done these studies in mice where they can measure how much oxygen do they use at rest and how long do they live. And those mice who used oxygen the best lived a full 36% longer than their peers who didn't use oxygen as well. And so that really is where the aging comes from. And so another word for this decreased oxygen utilization would be functional hypoxia. And if any of you have ever had low oxygen levels, like if you've had a lung infection or if you've had sleep apnea, you know how incredibly fatiguing that gets to be. But then ultimately that also leads to then mitochondrial decay. And once you lose those mitochondria, everything just gets worse. And so I'll also take this moment as a little plug. One of the other great ways to improve your oxygen utilization is exercise. So for those of you who've been looking for another good excuse to get out there and hit the gym, this is it. That cardiorespiratory fitness is important. So, okay, ozone directly improves how well your body uses oxygen. So because it drives that electron transport chain and increases your mitochondrial number and function, you get better oxygen. And so those short chain ozonides that we talked about, when the ozone interacts with the blood, it creates those things. You pair that with NADH, and out the other side, once it goes through all of those metabolic processes, you get water, NAD, so not just ATP, but those of you who have been following NAD, or maybe you've had NAD IV yourself, you know how great that is for energy, and plain old oxygen. So there's all kinds of good things that can come from this. And because of that, I like to think of it really as being kind of the great activator. And so we've got research on ozone therapy for boosting your immune function, activating all those enzymes that allow your body to take care of an infection on its own. Obviously, mitochondrial function, we've talked quite a bit about that. directly related to mitochondrial function is your metabolism. So if you feel like your metabolism has really just slowed down, it's not functioning as much, this is something that could be a piece in the puzzle to kind of help rev that back up. Any kind of regeneration, any kind of rebuilding that your body has to do, tissue healing, you can use this before and after surgeries or after an injury to help that recovery. Circulation, there are an awful lot of studies on the cardiovascular benefits here, not just revascularization, but preventing damage if your circulation just isn't as good. I think especially for maybe diabetics who have some circulatory challenges, especially in the legs and the feet, it is a very potent anti-inflammatory. It activates all of your antioxidant enzymes. It is directly antimicrobial. And so there's some really fantastic things coming up that we're going to talk about, especially for chronic infections, those ones that you just can't seem to boot. And so because ozone is directly antibacterial and antiviral. In fact, someone mentioned that they've used ozone ointment. And so you can actually buy those on the internet. They infuse different oils and things with the ozone, and you can put it topically on the skin as an anti-inflammatory, but also as an antimicrobial. So if you have an infected rash or something, you can use it that way. Within the bloodstream, you get some of that effect, but then you also get that incredible increase in immune function, and it does wonders for decreasing viral replication. And that's really the key. So for those of us who have that kind of under-functioning immune system, we pick up everything that comes around, or maybe we've got something chronic, like a chronic Epstein-Barr virus or HSV. Maybe you're the one who gets cold sores all the time, or shingles, if you're prone to shingles outbreaks. Having something like this on board will help keep that virus in check and help you kind of get over the hump. And especially when it comes to lung infections, yes, I think adding ozone would really speed up the infection or the healing process there. So, all right, just a little history on it here. This has been around since the 1800s. And so the exciting thing about this is we used ozone as our antibiotic before penicillin. Now, penicillin changed everything, but this is not new. It's gotten infinitely better over time, and it has gotten just really better and better. The reason you don't see a whole lot of it out in the world is you can't patent it, right? And so there's no drug company that's going to invest in this. They're not going to spend their millions on marketing and huge trials and that sort of thing. And so that's why it's a little bit under the radar, but it is very safe, and it's got a very long record of efficacy and use. So that's all kinds of fun. And is it safe? That's always our big question. And yes, we've got hundreds and hundreds of research papers. There are international societies. If you're someone who likes to read those kinds of things, you can probably access their databases online. They've kind of collated all of those references into one location. So feel free to have fun with that. The big key here is never, ever, ever inhale ozone. And so it is directly toxic to the lungs. If you breathe it in, you're going to have a big time problem. So don't do that. If anyone ever suggests you do that, you run away from them. We do ozone IVs. And if you're going to do that, it has to be done safely, and it has to be with pure medical grade oxygen. So, and that's because room air is not just oxygen, but it's also nitrogen and all of those other things. You don't want that going into the bloodstream. And so the quality of the ozone generator you have and the quality of the oxygen that you're using absolutely matters. And I can tell you, our team here has put in a ton of research to make sure that we're getting, the top of the line, the best of the best. The other thing is you want an experienced injector, someone who's going to get the ozone into the right place. And that, yes, you can be confident in that. We've done a ton of injecting around here. So that is all good things. This is what it looks like. So there are two main ways that we're going to be doing ozone here. Prolozone for joints and pain and healing there. And then major autohemotherapy, which is kind of the IV version. So prolozone, which we'll talk about now, we can use it all on its own, or in conjunction with PRP if you really want to turbocharge things. And that would be something that we would discuss together just in terms of, what your goals are and what we're treating. But it's a very sterile, very safe injection. It goes into the joint space. And while it's in there, it has that anti-inflammatory action, that regenerating action. It improves circulation and oxygenation. And so especially when you're talking about in the joint where there's not a lot of circulation to begin with, this can really help speed up that healing process. Some injuries, they just never get enough blood supply to fully recover, right? And so I know so many people who say things like, oh, I've got a bum knee from that thing that happened to me 10 years ago. Well, you probably never had quite enough oxygen to heal it. And it can be used on the lower back. So you can use this in really any of the joints, knees, shoulders, elbows, ankles, toes. You can use it in the soft tissue, in the muscles. You can use it for tendinitis, for low back pain, for sciatica, you name it. And so, especially when you've had an injury and it has created probably some swelling and muscle spasm. If we've got any weekend warriors in here, I'm well acquainted with the injury process myself, if any of my patients are here. When those things happen, all of those processes, the swelling, the spasm, it all constricts your blood supply and decreases circulation. And the blood is what contains all of your good healing juju, and it contains all of that oxygen. And so when it all gets clamped down and you don't get that circulation, you don't heal as well. Once you add that oxygen in, then everything can get going and everything can start to heal. And so when we talk about restoring normal health and function, that's a pretty critical piece. Hang tight. So there's a ton of research on prolozone, adding ozone into your prolotherapy solutions and into the joints, especially for osteoarthritis and pain relief there. So then this is the MAH, the major autohemotherapy. I don't like that name. That sounds kind of scary. I would just, call it Ozone IV, or we've got somebody here offering it up as the EBOO. But basically what happens is, in a very clean, tidy way, this is not a messy process at all. We have the blood come out of you and get collected into a nice little bag. Then the ozone gets kind of infused, kind of bubbled through the blood, and we shake it up, and it's very, very cool. You can watch it happen right in front of you. The blood will go from this kind of very, very dark red color that you see on the left and turn into this very, very bright red color here on the right. And then once that has happened, then we give that blood back to you. And so at no point is gas injected in your veins. If someone tells you to do that, you leave their office, pretty please, and thank you. The big key here is the way the ozone interacts with the fluid and with the blood. And so that's where all that magic happens. That process is very comfortable. We're not injecting things in that are going to be stingy. It's just like a regular IV. If you've got something chronic going on, if you've got a chronic infection or an issue that you've been fighting for a lot of years, chronic fatigue or fibromyalgia, I think you'd probably want to expect to do a series of these. Rome wasn't built in a day. It's going to take some time to regenerate all of those tissues and roll back some of that, mitochondrial dysfunction. But for acute things, if you're like, hey, I've got bronchitis and ain't nobody got time for that, come on in, probably just one. You're going to be in really great shape. And so if you've got a surgery coming up, you can do this before and after to kind of speed your healing. You can do it after an injury to speed your healing. And you can even just use it periodically as what I'm going to call here optimal aging maintenance, right? To make sure we're kind of bumping your metabolism along and giving your body its best foot forward when it comes to, repairing damage from the pollution and just kind of stressors of life that we all bump into. I intend to do that for myself as part of my routine. And so that's certainly something you can add into the mix for your routine, although talk to your doctor first, since I don't know everybody's individual stories here. All right, where's my mouse? There we go. And so that is great. We're kind of right on time. Thank you. That is all about it. So we have questions here. Can teenagers use it for sports injuries? Yes, absolutely. There is, if the injection process is safe for them, then the the ozone actually going in is also safe. So it's very, very natural. And so, depending on the injury and the patient, you want to talk about that with your doctor, because you just want to make sure that they're not going to get freaked out by actually having a poke. But yes, it can be done. Do we have any other questions? I've seen some interesting results in studies on using this for post-concussion syndrome. And so, some of the damage that comes with bonking your head, and, a lot of that has to do with decreased kind of glucose utilization and all of that. And ozone would only help drive that. And so if you've had a concussion, or even if you had your concussion years ago and you felt like, maybe not quite been the same since, it might be worth a try. A person who was doing this for a sports injury, would they need multiple therapies? Maybe. I'd say that depends on the severity of the injury. So that'd be something you'd want to talk to your doctor. And for sports injuries around here, that would be me. So, but I would say, generally speaking, the younger someone is, the easier it is to correct. So would this help with mold poisoning? Absolutely, yes. And so the big key when you're fighting a mold issue is to get rid of those mold toxins. And so it's all about supporting detoxification pathways. And you need very functional mitochondria in order to do that. And so, yes, I would absolutely add that in, while I was also doing things like, making sure you're eliminating really regularly and obviously avoiding the source of mold in the first place. All right. How's it different than hyperbaric oxygen? Oh my goodness, excellent question. Thank you for bringing this up. Hyperbaric oxygen is wonderful stuff. I'm a huge fan. I think it's great. I love that we have it as an option. Hyperbaric oxygen basically drives extra oxygen into the body and into the bloodstream. It's as if you were breathing extra. And so what comes in ends up being just that plain old O2 in the bond. And you don't get that, if you remember the slide with the plus and the minus on the sides, and those electron charges and that ionic bond there is what interacts with all of those other antioxidant enzymes and what creates those ozonides. So that's the magic, and that's what separates it from the hyperbaric. What I would say is, in terms of efficacy, you've got breathing room air that's going to oxygenate you. Hyperbaric does an amazing job of oxygenating you even more. Ozone goes even beyond that. So there you have that. Let's see. For chronic back pain, hand and sciatic, would we do IV or like actually inject the spot? That, I would say you want to just talk about that with your doctor, because it kind of depends on where the pain is coming from. But, for a lot of people, when they have lots of different pains all over, you're almost better off doing the IV version, because then it treats your body all over. Now, if you have lots of different aches and pains because of lots of different injuries, which I can attest to, then you might want to consider injecting each of those places individually. So I would have that conversation with your doctor. Any contraindications? So yes, obviously, if you can't do IVs for whatever reason, you don't want to do this. If you've got big time conditions going on, things like cancer, I would avoid it. For people who are pregnant and nursing, you definitely need to be talking to your physician. Most of the contraindications some of the offices are pairing ozone with high dose vitamin C, and there are some specialty labs that you need to do before then. And depending on your specific case and the protocol that you're using, we might want to draw some labs first just to make sure that we've got the dosing right for your particular physiology. Generally speaking, though, most people can do ozone. And can it balance hormones? We don't have any research on that directly. And so, it's not like I'm going to say, okay, we'll do this ozone IV and hey, your estrogen's recovered. Woo! That's probably not going to happen. But I can tell you that one of the things we see around here all the time is that as the body gets healthier and as the body functions better, lots of unexpected things tend to recover on their own. And some of the symptoms of low hormones could also be symptoms of just low mitochondrial function and decreased oxygen utilization, things like aches and pains and fatigue. So Would it be a good choice for someone who needs hormone balancing? Yeah, definitely. Would it be a standalone therapy? Would it be the only thing you need to do? Probably not. You're probably going to need a couple of other things in the mix too. The cost depends on how many passes you do. And I have to apologize because that number just flew right out of my brain. I have it written down. Bear with me 1 second. Oh, that busy mom life. Sometimes these things. Okay, good. That's what I was thinking was correct, but I wanted to make sure I didn't lead everyone astray. So for the IV, it's going to be $250. If you want to do a second pass, which is like, oxygenate the first round of blood and then do it again. So if you want to have multiple passes of oxygenation, then it's an extra $50 for each pass. For the Prolozone injection, it would be $300 for the joint things. Okay, how long does it last? Oh, I wish I could give you a really great answer on that. That depends on the condition, right? And it depends on how big of a nudge your body needs to recover. For joint relief, I would say for most people, anywhere from maybe 1 to 3 treatments, and you're going to be in really good shape. If you've got some significant damage, or if you're prone to re-injuring yourself, like some guilty parts here, then probably more. So, okay. For someone who is not currently a patient and they just want to do ozone, what does that look like? So that's easy peasy. If somebody has just a very acute thing, they can come in, they can do a really quick consult that is tailored to those specific complaints, and we can get them going. So they don't necessarily need to go through a full, all the hormone questions and everything else that we do. And does it make you feel yucky, like NAD? So that is also something that's going to be individual for everybody. So the reason that people sometimes feel yucky is if we start spinning those metabolic processes really fast and giving the body lots of energy, and it starts doing all of its housekeeping all at once, sometimes you can get what's called a Herxheimer reaction. Or if we kill off a bunch of infection, those little bugs release things to make you feel gross, so you'll stop doing what you're doing because their goal is to survive. And so, yeah, sometimes people do feel icky. And honestly, I would say if that happens, that's probably a good sign. That means you're hitting the nail right on the head. For most people, no, they're not going to feel icky. They're just going to feel good afterward. All right, you guys have amazing questions. Okay, let me make sure. All right, I think we've covered all of them so far. Thank you all for hanging out with me today. I hope it was helpful. If you have any other questions, or if there's something that we went over, or if you wanted to talk about it just in private, feel free to call us, message us. We'll get you on the calendar. How long does it take? Excellent question. So for the injection, that's actually pretty quick. You'd probably be in and out. All told, visit and everything, 45 minutes. For the IV, it's going to be a little longer because we've got to get the blood out and then put it back in. If you're lucky enough to have great big pumper veins, probably an hour. If you've got smaller veins like myself, probably a little bit longer. So like a typical IV kind of experience. And how quickly can you see results? For most people, they're going to feel a difference pretty much right away. But if you've got some really deep-seated chronic things and you're going to be doing a series, it might take a couple before you notice a difference if your body's got a lot of healing work to do. So that would probably be a great question for your doc, depending on what you're trying to address. All right. So yeah, feel free to get set up with your doc if you want to chat more, or if you have other questions. And hopefully this has been helpful for you guys. I know the deeper we got into this, the more excited we were to be able to offer it. All of us have a whole list of people in mind that we think it could be really helpful for, and we're all planning to do it for ourselves too. So I hope you guys have a really great afternoon. Thank you.